Toothworms and Spider Juice, read by Natalie Barton. Chapter 10, Changing Times and the Father of Modern Dentistry. In 1683, the Dutch naturalist Anton van Leeuwenhoek was shocked when he turned his newly invented microscope on scrapings from the teeth. He saw animalcules, bacteria, in such great numbers living on the teeth that he was at a loss for words. He finally asserted that the vast amount of microscopic life in a human mouth far exceeded the number of men living in his country. When the 18th century rolled in, the scientific data from Leeuwenhoek and the work of a dentist named Pierre Fauchard helped give birth to true dentistry. In the early 1700s, Paris was one of the greatest centers of science and culture. Wealthy people came from all over the world to enjoy the city and its entertainments. Having an attractive appearance with nice teeth became important. It was during this time that the founder of modern scientific dentistry, Pierre Fauchard, 1678 to 1761, wrote his far-reaching book on dentistry. This remarkable Frenchman had trained as a military surgeon and dentist before settling in Paris. He organized dentistry for the first time into an independent profession, separate from the medical field and, more important, from the trade of the tooth drawers. In 1723, he completed a book, The Surgeon-Dentist, or Treatise of the Teeth, although it was not published until 1728. It was the first complete book on dentistry ever written. A second and even better edition, consisting of 843 pages, divided into 2 volumes, was published in 1746. This was an unusual book for its time because other practitioners never gave away or shared any of their knowledge, keeping it a well-guarded secret. Here are a few of the many dental issues discussed in this book, some of which are still current today. Toothworm Theory. Fauchard rejected the long-held toothworm theory as the cause of decay. He claimed that he had never seen a toothworm, either with the naked eye or a microscope. Trying not to offend past writers on the toothworm, he mentioned that if it did exist, it was not the cause of tooth decay. Insect eggs from overripe foods may have entered the cavity and hatched, producing worms, maggots. Fauchard believed that the real cause of tooth decay was humoral imbalance. He stressed the importance of keeping the teeth clean because dental health affected the whole body. Education. Fauchard emphasized the need for specialized dental education. He had no respect for tooth drawers, calling them a theater of impostors who tricked people. He also blamed bad dentistry on procedures practiced by unqualified people from unrelated professions offering oral health services. Periodontal disease. Fauchard was far advanced for the times in his understanding of periodontal disease. He was a firm believer in scaling teeth and debridement of root surfaces. Extractions. In his book, Fauchard describes 5 kinds of instruments he used for extractions which were available to all dentists: the gum lancet, the punch, the pincers, the lever, and the pelican. He found the pelican the most useful because it took out a tooth more promptly than the others. But he warned that if someone didn't know how to handle it, the pelican could be the most dangerous of all instruments in extracting teeth. Orthodontics. Fauchard proposed methods that laid the groundwork for modern orthodontics. He realized the need to align teeth in the jaw because crowded teeth were hard to clean and caused decay, infection, periodontal disease, and tooth loss. Bridges and dentures. Fauchard was highly skilled in prosthetic work. He made drawings for his book to show how he used silk, linen, and metal threads to fasten artificial teeth and bridges to neighboring teeth. Fauchard recommended using human teeth or teeth carved from walrus or elephant tusks for dentures. He also developed ways to keep upper and lower dentures in place by joining them together with springs. Though these dentures had a lot of drawbacks, like springing out of the mouth while the wearer was talking, his pioneer work in coloring and enameling denture bases to simulate natural gum tissue inspired later dentists to make more lifelike dentures.